I think there's been studies on having a provider that looks like the patient to see if that improves outcomes. There's been studies that have shown that African Americans are given less opportunity to have a coronary artery bypass surgery as opposed to medication. And also when it comes to pain, that they are given less pain medication than other races. And so they looked at the studies if there's a concordance between the race of the patient and the race of the provider, that help decrease the discrepancy. And it didn't to the extent that we thought it would. So while we can identify with people that look like us and hopefully we can, we would have less bias, we were trained in the system that has generated some of these biases. So even though the provider plays a part in making sure that we treat each patient individually and look at their circumstances and not look at their race, the patients have some empowerment too. So I think we have to learn to speak up. I believe that in my culture, when I was young, the doctor was on a pedestal. And even my mother and my family tried to put me on a pedestal. And I told them, don't you dare call me Dr. Best. I'm Lydia. I've always been Lydia. So they know. But, we have to speak up for ourselves. We have to be our advocates for ourselves or bring someone that can be an advocate for us. We have to seek information from reliable sources. So, we don't want to just look at someone on the internet. We have to look at their credentials. But once we find a reliable source, we can arm ourselves with information. We can acknowledge our own biases. We talked about the fear and the mistrust. So if we're being led a little bit by fear of the medical profession as a whole, we can acknowledge that and then maybe have a discussion either with the provider, the nurse. We have community health workers that can, that can be that advocate for our patients. So acknowledging biases on both sides of the table can help. And then making sure that we know that we're partners in this. We don't have to go to the extreme of do whatever the doctor says, and we don't have to go to the extreme of we're not going to believe or trust the medical provider. We're partners. And if there's something that you're not comfortable with, it's better to speak up while you're in the office and get an alternative rather than take the prescription and, not fill it.